Okay, go ahead, Mayor.
Okay, well, thank you, Steve. And as we talked about, we need to find a jingle to open up the program here and have some music in background. Welcome, everybody. I believe this is our 8th week of doing a mayor's breakfast on a weekly basis. The purpose of which is try to focus primarily on COVID and questions that our residents have about COVID and the things that we're trying to do as a community holistically to keep us all informed, to make sure that we make good decisions around the COVID. We've tried to get a variety of guests come who can talk about different aspects of both COVID and how the community is adapting. This week, we have returning, as we have almost every week, Dr. Joseph, who near the end of the program has some information to share with us. And I so appreciate, Doctor, and your busy schedule that you're here for our residents and to describe stuff. We have from the CPC, Community Presbyterian Church up in Danville, Pastor Tyler Scott, and he is going to be talking about both houses of faith and how they're being impacted, the food bank and how that's being impacted, and nonprofits. And I appreciate him being here to share that. We have another special guest, Mike Conklin from Sentinels of Freedom, somebody who from the ground up created the Sentinels of Freedom program, which helps our returning wounded veterans become reintegrated into our communities. Mike's going to talk about not just nonprofits and the battles they're having, but also how our veterans are adapting to this. And I'm looking forward to, Mike, your comments and things along those lines. Returning every week, as she has, is our county supervisor, Candace Anderson, who is probably one of the busiest people anywhere here in the Valley. As you know, the county is on the front lines from the health department and creating the health directives for us. And the county supervisor, she has the job of having to go out and explain to all of us what's going on and handle those questions. We sure appreciate you doing that. And of course, Steve Spadowski, our deputy city manager, is coordinating all this and collecting questions. In fact, it's a good segue into if you have questions for our guest today, you can always send it to info@sanramon.ca.gov. And Steve will field those questions, but also we're encouraging people to send questions in on just stuff about the Valley or the city. And beginning next week, we'll have a viewer questions or viewer mail segment to answer those kinds of general questions. Thank you, Steve. And of course, our city manager, Joe Gorton, who is the guy at the end of the day who's really making all the pieces work in San Ramon. And I always love the opportunity to tell Joe, I appreciate everything you're doing. You're carrying the weight of the city on your shoulders. You do it with grace. And we are so appreciative of what you do for our city every day and how you've managed us also fiscally, because as tough as things have been, you've helped navigate our city fiscally into a spot where we're not in bad shape. So thank you, Joe.
Way to go, Joe.
I agree. I'd like to quickly give Joe a chance to always lead in with stuff that's going on here in the city that he wants to share with residents.
Thank you, Mr. Mayor. And as usual, I like to leave the majority of the time to the folks here that have donated their time to inform us. There are a few things I would like to bring to the community's attention. Unfortunately, our Art and Wind Festival is canceled, but we are holding a virtual Art and Wind Festival, and that'll have activities and directions on how to make candy coated waffles and opportunities for kites to be picked up at the community center. So we're trying to do a virtual Art and Wind Festival that will I'm not going to say rival our Art and Wind Festival, but we're trying to make do with a virtual Art and Wind Festival. A couple other things that is important would be to notify the community that the City Walk draft environmental impact report is out. I know that's an important thing to the community, and there's a lot of interest in that. And you can find the draft environmental impact report on our website. You can pick it up in a hard copy. You can ask questions, or if you have any information you'd like to share, Mr. Lauren Barr, our planning manager's name and numbers on our website. You're welcome to contact him. And then along those same lines, our Crow Canyon specific plan is also out for public review. So those are important things, and it's important to get that out into the community while we're still dealing with the pandemic. As far as the city goes, we continue to react to the health department orders as they amend them and update them. And we're looking forward to, continued business activities ramping up. So if there's any questions or anything the city can do to foster that for the community and help, please call. All of our phone numbers are listed on our website, and I will defer real quickly to Stephen, who usually gives you a quick run through on the website, and we can move on. Thank you, Mr. Mayor.
Thank you, Joe.
All right, I'll share my screen here really quick. And once again, if you go to the city's webpage at sanramon.ca.gov, on the front banner, there's a COVID-19 link, and you click the link. Any and all information that the city comes across is located here at kind of a one-stop shop for residents to go if they have any questions or would like to connect directly to any of our county or state representatives. I want to highlight something that we did highlight a few weeks ago, but remind people that we do have a business assistance program now with the city of San Ramon. So if you are a San Ramon business, that's the only pre-qualification that you need, you can watch a brief webinar that we conducted regarding the program, and then you submit a business verification form, and you will receive one-on-one help with Townsend and Associates, our consultant that will help you through all of the assistance programs that are available to businesses. And I'd also like to note that even if you have already applied for assistance and received it, you can still apply for the program in order to ask Townsend any questions or guide you through compliance with your grants. And that's all I have for this week, Mayor.
Thank you, Steve. Just as a program note, last week was easily our largest audience we've ever had for one of our broadcasts, and saw it shared in lots of areas on social media. So I'm really appreciative of that. And also, I want to thank everybody who sent emails and notes and texts and phone calls on that. I really appreciate the feedback, because the more we as public officials and leaders hear from community residents about their concerns and fears, the better decisions we can make. The other is that, making notes, I have been continuing to talk to the county health director, and I want to thank them for being very helpful. I had a series of questions I was asking for follow-up, and they were very good and giving me good information to help us understand what's going on. And so I want to thank you. And the other quick piece is that I'm getting calls from residents who are concerned because the broadband is not as vibrant as it used to be in our city. And also getting calls from some of our service providers asking that how they can amp up their service, because we have residents at home that are trying to work from home. Their kids are trying to go to school and do learning on the broadband. And then you have people who may not have children or working, but they're trying to downstream entertainment as they're in their homes. And it's really stressing the broadband. So I want residents to know that we are in communication with our providers, and we will look through the issues and try to encourage them to amp things up, especially in some of our neighborhoods that may not have as strong a signal as they would like. So having done that, I always like to introduce our county supervisor, Candace Anderson, to give us an update on the county. Geez, Candace, is anything going on this week?
No, not at all. No, and I was going to say, with regard to that connectivity issue, I have had to use Ethernet to connect my computer, because otherwise I'm regularly getting dropped off of my Zoom meetings, because you're absolutely right. I have two other adults working from home in my house, and they're drawing all the all the internet strength, all of our Wi-Fi strength. So I always want to start out with just thanking profusely the community for all you have done, for your support, your cooperation with these health orders that we have been issuing as we gradually reopen up the community. With your work, we avoided deaths in our community. We avoided a huge surge that could have overwhelmed our health system. And as now we're seeing our numbers flat and stable, we're moving forward. But we're not just, like I always say, and others too, we're not just flipping that switch. It's sort of like a dimmer that we've got to gradually do so we can measure our progress and ensure that we're not seeing a significant increase in cases, and more importantly, a significant increases in hospitalization. So since since last week when I was here, I always like to sort of give you the big picture. Last week, we were about 1,089 cases. And we've increased just in 1 week, 145 cases in Contra Costa County to 1,245 cases. And so last week we were averaging about 12 new cases in Contra Costa a day. This week we've been identifying 21 new cases a day. Now, admittedly, we're doing more testing, significantly more, almost twice as much testing as we were in previous weeks. We've ramped that up, and that will account for those numbers. The good news, though, is that our hospitalization is remaining flat, and that's what we're most concerned about, the capacity to handle the more serious cases. Last week, I reported that you had 2 new cases in San Ramon. You were up to 36. Well, this week you've had 4 more cases, and so you're up to 40. And the only reason I really bring this up is just to remind you it's present in your community. And so you want to ensure when you're out, you're wearing masks in case you happen to be the one who's spreading the virus, and that you take precautions. And when you go out to the store, don't touch your face. Don't try not to adjust your mask if you're wearing one. And by all means, wash your hands and regularly follow those basic practices that we've been encouraging all along. So last week we were, the other interesting thing as we do this increased testing is you kind of hope you're going to have the same percentage of positive, which would indicate it's just sort of a certain percentage within the community. Last week, when I came to over the 7-day period, we were averaging of those who were tested 1.9% COVID positive. This week, unfortunately, that number has doubled. And so as we've been testing, we're showing 4.2% of those who are testing positive. And there is a significant lag right now in getting test results. And I understand there's been some inquiries about that, and I might as well address it now. Because we've increased testing, other counties are increasing testing. A lot of our commercial labs where we send our tests out to are seeing delays of even up to 10 days, 8 to 10 days. And so it's troubling to those of you who have been tested. What I will say, if you are feeling any unusual symptoms, if you're not feeling yourself in any respect, because we know COVID manifests itself in many different ways, just keep to yourself, isolate yourself, quarantine until you get those test results back. And we're in a new world right now where we used to say, oh, if you just have a sniffle or if you just, you're just not feeling well, it's okay to go out. Right now we're taking nothing for granted. So if you went in to get tested and you're showing any symptoms irregularly, just stabilize, quarantine yourself until you're sure when you get those test results back. And as I mentioned, hospitalizations remained flat over the last 7 days. We averaged about 19 who were hospitalized. So we're right in that 18 to 19 hospitalized, which certainly is indicative of us being able to handle any new surge should that go forward. When I was with you last time, we had not had a death for a little while. In fact, we went 8 days without a death. And very sadly, yesterday we had 3 new deaths reported, including someone who was in his 30s. And I don't have any data about whether there was an underlying condition or something else that contributed to his death, but this is the youngest death we have seen in our county. So what's new? What's going on in the county? What new health orders? Each week I come, there's something new we're doing. And so on Tuesday, I'm really pleased that we were able to move into the early phase 2. We all desperately want to get all of our businesses open and running. We want the retail open. We want Bishop Ranch to be full of the many businesses that are there that may not have been essential and able to be open. So we are going to continue to measure the results of this most recent opening on Tuesday. And our current health order ends on May 31st. And yes, there will likely be other shelter in place orders, but I'm really very hopeful that we're going to be lifting additional restrictions and going into a full phase 2, absent some drastic turn of events, particularly in our hospitalization numbers. So with this new opening, it allows all retail to open to curbside, meaning you can order ahead of time, you can call ahead of time, stop and pick something up at the store that is now available to do that. But it also allows all of the back end, the manufacturing, the warehousing of goods and supplies. So it's something that, again, we're opening up another segment of the business, and we want a business community, and we want to continue to be able to do that. And so as Dr. I'm doing it again. Farnatano said last week, they're relying upon the health officers in the Bay Area, with the exception of San Mateo, that's doing a little bit more of an aggressive approach. And they're relying on these indicators, which are, and I'll just repeat them, that our number of cases in the community is flat, decreasing. Number of hospitalized patients is flat or decreasing. And while we're seeing a slight rise in the number of patients, our hospital numbers are good. That we have the capacity, we sure do right now with regard to our ICU and our ventilators, if we have sufficient testing. And that's the one area that we are just pushing to, still encouraging all of you to get tested. Right now, our goal is to have 200 tests per 100,000 people in our county per day, which comes out to close to 2,200 tests. We're averaging still closer to just under 1,000 tests a day, or 77 per 100,000. So we're really encouraging people to call up, make an appointment. We also have the 3 state test sites where you can go online to make an appointment. And if you go to the coronavirus.cchealth.org website and you go to the little line that says get tested, it will give you both the link to go online to sign up for the state sites. The closest one is in Tice Valley in unincorporated Walnut Creek. And we really want you to get tested. Again, if you have any symptoms, absolutely, even if you're asymptomatic, we still want you to be tested. And we encourage you to work with your primary care provider. There you'll get your results faster. You'll get them on your own dashboard of your My Health, whether it's My Kaiser or My Job Mirror, whatever provider you have. So encourage you to really sort of move forward with testing. And what we're really looking at too is ensuring that we're testing not just those who are asymptomatic in the general population, but really focusing on congregate care facilities like our rest homes, making sure that our healthcare providers are being tested at least once a month in our congregate care homes, as well as patients, because we know that that's been such a source of spread of the virus in a very deadly way. We're also looking at communities where we're tending to see a larger spike than you're experiencing here in San Ramon. Some of our West County communities are seeing a higher volume. And so we're focusing on opening new test centers out there and simplifying the process. Now, admittedly, people are intimidated to get tested. The idea of sticking a swab way up your nose isn't necessarily appealing. And as I've shared before, I've done it. Yeah, it's not, I don't know, I wouldn't even call it, well, it's not painful. Let me put it that way. Little uncomfortable. I described it as a tickle and had a doctor email me and say, well, then they must not have done a good job if they just called it a tickle. But in fact, it really was not that painful at all. It really just was a little uncomfortable for a second, and it was done. And it was a great way to ensure that we get the test counts we can. The state, rather than encouraging 200 per 100,000, they're encouraging 150 per 100,000. And so we're going to keep moving as fast as we can to get that. There is some hope that there may be a saliva test that will be approved soon. And I'm sure many people would be very happy to spit into a cup or a vial rather than having the nasal stuck up their nose. But don't wait, especially if you're feeling any symptoms. And so right now, the county is doing about almost half of the testing that's being done in Contra Costa. Prior to us doing this big ramping up, we were only doing about 30% of the testing. And we understand that some of our healthcare providers like Kaiser is ramping up their ability to process more of the tests, and that will also help us move toward that very important test numbers. So encouraging you to do that. And we've had a few more cases identified in the jail, but not in the general population. As I've mentioned before, we've been very, very careful when someone is admitted to jail. And right now, under the state law, we're only allowed to admit the most serious of offenders, but we've been able to, through the initial screening or through the 14-day quarantine period, we put them through, identify. So in total, we've identified 3 COVID patients, and then we have the facilities on site to completely segregate themselves from all of this jail population, including those others. Our ad hoc COVID committee meetings are something that are a great opportunity for the public to engage with our health officer. Dr. Farnatano is at all of those meetings with me. I chair this committee with Supervisor Mitchoff. Yesterday, we had over 150 people engaged in a Zoom call, and we were finishing up a discussion about recreational activities and then going into a little discussion about retail and how that might open up. We continue to encourage everybody to plan for the next phase. So if you're a retail business, if you're an athletic team, start looking at how are you going to, when allowed, be able to reopen, start your activities with appropriate social distancing. And so people are coming up with some guidelines. Now, what we're trying to do in the county is watch for the state guidelines. We'd like to see consistent guidelines up and down the state, but the state has not started publishing guidelines for phase 3, which includes things like gyms, public swimming pools, sports teams. And so what we're working on right now is, if you have guidelines, we do want to have you get them to our health officer and as well as send them up to the state, because we are going to be working on these guidelines together. Now, as the state opens guidelines, we may not instantly implement them, but we'll follow their guidelines, but on the county's timeline. I see us moving very quickly to catch up with the state, just because our numbers continue to be stable. People continue to do what they can to stop the spread within our community. And if you want to join us on the ad hoc committee, next Thursday, we're starting at 1 p.m. and we're going to be talking about worship services and how that's working now virtually for so many faith-based groups, and how we might be able to open that up in the next phase if possible. And there's a lot of interest in it. Certainly the Department of Justice has notified the state that they think it's inappropriate for us not to be allowing worship services to be taking place when we're allowing people to crowd in grocery stores or Home Depots. And so it's a very sensitive topic, and one that our churches and synagogues and other faith-based groups have really figured out how to sort of pivot in this crisis, but we want them to be able to gather together as a community. And I know a lot of different faiths are coming up with guidelines where they're encouraging families to sit together, but 6 feet apart from another family, and coming up ways to do the communion or sacrament, whatever they need to do that in a safe way. And so I'm very hopeful that in our county, it's going to be sooner than later that we can go back to our faiths meeting together as congregations, but we'll have that as a topic next Thursday as well.
Candace?
So yes.
Okay,
That's
a great segue. We didn't practice that, but that's a great segue.
Well, I saw Tyler there. And so, yeah, you've got Tyler there. Let's talk about faith-based groups.
Tyler is here to talk not just about the faith-based challenges that they're going through, but also they have a very robust food bank. And I want to talk about that and some of the families that are challenging. And I wanted to hear from the frontline nonprofits, the challenges they're having, how they're meeting them, and how they could help us. So, Pastor Scott, it's all yours.
Thank you, Mr. Mayor. Thank you, Supervisor Anderson. Appreciate your updates as usual. And thanks for the invite to be on this forum. What a treat to see these leaders in the community and to be among them. So yes, you mentioned a pivot that faith-based organizations or churches in particular, Supervisor, were able to make. And the biggest one that we've made is moving all of our services immediately when we started to shelter in place online. Many churches have done that. They've done that effectively. And some churches were not able to do that immediately. So one of the things that we were excited to do at the beginning of this is we had some of our tech producers and team reach out to other churches that did not have their services online and help equip them and empower them to get their worship services online so that they could reach their people and their people could reach us. That's just another way of being for either other churches or people in the Valley. Our church is really big on this motto called For the Valley. And what that simply means is for far too long, the church has been known for what it's against, and we want to be known for what we're for. We're for the people of the San Ramon Valley. We're for the first responders, the local businesses, the families, the local government, and those types of things. So just an opportunity to be for people. Mr. Mayor, you mentioned the food bank. We do have something called For the Valley Fridays. We have them every Friday afternoon between 2 and 5 p.m. And this is an opportunity. They have been drives of food. We've allowed people to bring at first we allowed people to bring their extras, their extra clothing, their extra tents, their extra sleeping bags. Now we've narrowed it because the real need is food. our primary partner for a food bank is actually Monument Crisis Center out of
Right.
Concord. They do a phenomenal job. And so even this Friday, you can bring your canned goods down. We'll collect them between 2 and 5 at our church. It's 222 West El Pintado, right in downtown Danville off Diablo Boulevard or Diablo Road, excuse me. And we can take those for you. But I kind of made a little list of the different ways that people could serve during this time. And the food drive, Mr. Mayor, you're right, is one of them. And that partnership, Monument Crisis Center, they do great work. They've been a local mission partner of ours for many, many years. But believe it or not, because people are still sheltering in place right now, I believe, and we believe, that one of the best ways that people can serve, because that's people are wondering, how can we serve others during this time? I think the best way is to love their neighbors. And I mean their actual next door neighbors. And could be as simple as asking this question. It's a great question, I think, is what does love require of me during this time? And it might be as simple as, oh, I'm going to wear my mask when I go out in public. But it also could be, I could reach out and actually get to know our neighbors on a walk and recognize that many of them may be struggling with things like depression or fear. There's a lot of fear in our culture, in our community right now. Well, there was a lot of fear at the beginning. Now it is transitioning among a lot of people into annoyance and anger, and they really want to reopen as quickly as possible as some of the goals that we set at the beginning are being achieved. But going on a walk and talking and checking in with your neighbors and seeing ways that you could serve them is a really easy way to love your neighbors right now. And another way you could serve is to support our local businesses. We hear about meals at local restaurants that are able to do takeout, but many of those local businesses are actually serving others as well, and you could partner with them. And then the last thing that just kind of jumps to my mind is many of the most at-risk people in our community, which are our seniors, have needs either at their homes or their larger group homes. And it could be anything from landscaping to shopping to running errands to another, and this may seem small, but it's particularly meaningful to people, especially if they're not able to get out during this time or receive visitors or have that human touch that is so important to people. Handwritten notes is something that we're efforting to do with, our congregation is very big. It's a few thousand people, but we're efforting as a staff right now to engage every member and regular attender in our church through phone calls and handwritten notes to check in with them personally. And that could do wonders for people that are at your actual next door neighbors. Yeah, I could name a couple other things. We've had a couple of blood drives that have been totally sold out. We have 2 more set up that are coming up in the coming months, one in June and one in July. But seniors, and we have a counseling center. I've heard from many people, and Dr. Joseph, you would be probably the expert to speak into this, but heard from many that anxiety and fear and depression are on the rise. I've heard, and you probably have too, that the suicide rates are skyrocketing during this time, and people struggling with addictions and that sort of not able to get the support. But we have a counseling center, CPCC, Community Presbyterian Counseling Center, that, believe it or not, has been able to pivot to online or Zoom-based counseling very, very quickly. And they have not seen a drop in their counseling appointments. As a matter of fact, the last month or 2, they've seen an increase over some of the prior months of this year. So we're very glad to be able to offer that type of support and service to our community.
Pastor, I want to thank you for outlining what all of our houses of faith are doing here in the Valley. We can't have them all on, but I think having you on and describe the kind of work that all the houses of faith are trying to accomplish and working within the guidelines. Thank you for highlighting the mental health issue. There was an article that came out yesterday that a lot of physicians at John Muir are actually concerned there are more suicide deaths going on, spiking, than actually COVID deaths. And it's something we have to be very, very mindful of and incorporate into our decision making. Next up is Mike Conklin. And Mike may Well, Mike does require an introduction, even though he's well known to all of us. Mike has founded the Sentinels of Freedom. It's been a program that grew from literally one individual, one veteran, into a nationwide program that's helped hundreds of veterans become reintegrated into their communities. Mike, we sure appreciate everything you're doing. Tell us how this pandemic is affecting both you as a nonprofit, but also our veterans who are trying to reintegrate.
Sure. Thank you very much, Supervisor Anderson and Mayor Bill and Pastor Scott and Dr. Joseph, and of course, my old friend Joe Gordon there. All of you are known to me and for many years and good friends. And so it's a real honor to be able to come here and talk to you and our community today. I want to start off a little bit and then end up talking more about the local veterans. But as we approach Memorial Day this coming Monday, when every year we recognize and honor the sacrifice of our nation's fallen military members, I encourage all citizens to take the time to reflect and ask yourselves and your children a question. Historically, and still today, without the commitment of our young men and women to serve in our military, often during times of war and conflict, would we as a nation enjoy the quality of life and freedoms we have today? Over 1 million Americans, men and women, have paid the ultimate sacrifice with their lives for our nation, for our nation's freedom since the Revolutionary War. And this Monday, of course, we honor them. Our organization, Sentinels of Freedom, assists severely wounded and injured post 9/11 veterans in their transition back to our communities, onto post-secondary education, onto career opportunities leading to self-sufficiency. We provide mentors, financial assistance, and networking them into meaningful careers. You might understand the need for what we do by knowing that there are currently 47,000 Purple Heart recipients, meaning someone wounded in combat, from the conflicts in Iraq and Afghanistan so far. Additionally, thousands more have been severely injured in training accidents, shipboard accidents, aircraft accidents, and other service-connected accidents since 9/11. I'm very proud and thankful that Sentinels of Freedom was founded right here in San Ramon, and now has grown to support severely wounded and injured veterans across the nation. You can read more about what we do on our website, www.sentinelsoffreedom.org. Mayor Bill asked me to describe what issues our local veterans are experiencing due to the coronavirus and what we can do as citizens to help. And I think, let me first say that some may ask, is this our responsibility? I would hope that all of our citizens would answer that in the affirmative, and having done that, would ask themselves, what can we possibly do? The most affected and vulnerable veterans to CV-19 are our older veterans. The best thing you can do is to be aware of these veterans living in your neighborhood. California is the home to the highest number of veterans in the nation. Believe me, some of them live in your immediate neighborhood. They're kind of easy to spot. Maybe an American flag flying proudly in their yard, or a Marine Corps sticker on their truck, graying hair or maybe no hair, walking slowly, sometimes seemingly in deep thought, and maybe looking unapproachable. These are their well-earned sunset years. And I suspect this Memorial Day, they will be thinking, of the buddies they served with, and those they may have lost. Older veterans can become sedentary, leading to possible isolation from family and friends. Most will not ask for help, even though they may need help. The value of simply reaching out to them this Memorial Day, offering your thanks, and asking them if they need any help or anything cannot be underestimated. If they have higher needs, we have an outstanding veteran support community in Contra Costa, and I've said this before, I think it's the best in the nation. We have our Contra Costa Veterans Service Office, our Veterans Administration Hospital in Martinez, and a whole host of other veterans service organizations, including Sentinels of Freedom, Veterans of Foreign War, American Legion, Marine Corps League, Vietnam Veterans of Diablo Valley, and the Blue Star Moms. If you have a veteran in your neighborhood that you think needs some help, please feel free to call me at 925-380-6342, and we'll arrange for them to get help. There is just no reason a veteran should not be able to find help in Contra Costa County, but sometimes it's upon us to reach out to them. And then lastly, I'd like to say on Memorial Day, since we can't have our normal gathering at Oak Hill Park in Danville, if you get by Oak Hill Park, you might want to take some flowers up and put it at the memorial and reflect a little. We also have a beautiful memorial at the corner of Bollinger and Santa Moon Valley Boulevard, and you can leave some flowers there. Peggy and I will be doing that at both sites on Monday, and I think that's another way for you to honor them and also teach your children well. Take them with you and talk a little bit about the sacrifices that these veterans have made and those who have provided the ultimate sacrifice to our nation. And that's kind of mostly what I've got to say, except what a beautiful community we have, a great county, all these things going on. Pastor Scott, you mentioned about faith and loving your neighbor and all these things. We all, I've never seen so many neighbors in my community than the last 3 months, walking with their children, talking, out, socially distancing. But if there's a good part of this whole thing, I see more families doing things together. And I think that's maybe a silver lining in this whole thing. And it's really nice to see. So thank you. Thank you again.
Thank you, Mike. And also thank you. I know that all 3 of your sons served our country during the conflict.
Yeah.
And I appreciate the service of them.
Yeah, thank you.
Next up is our returning special guest. Every week he's a special guest, even though he comes every week, is Dr. Joseph, who's got some information for us. Always a good place to, again, inform residents how they can both stay safe and to help to give good information that's reliable. So Dr. Joseph, it's all yours.
Well, thank you again, Mr. Mayor. It's always an honor to be here. This session for me is always, I learn a lot. I'm very encouraged, very moving discussion by Mike. Thank you for letting me join you. I'm going to try to share my screen. Today, talk from some PowerPoint slides. And we'll see if it works. And there we are.
Yeah.
So is it showing up?
Yes.
Good. Okay.
Looks good.
The focus today is how to stay safe. A little bit different. And instead of just talking about what to do, I have some information about why we do it, how you protect yourself and how you protect others in the community. So masks are always a topic of interest. There still is a lot of misunderstanding and confusion about them. And I want to talk about these two. In the upper left is an N95 mask. It's fascinating to me that prior to the pandemic, uh, no one outside of a healthcare industry knew what an N95 was, with some industry use. But it means that 95% of particles that are zero point 0.3 microns or smaller are filtered. This is an inhalation filter. This is to protect the wearer. This is what healthcare workers use when they walk into a room of someone who is infected. These masks are limited. They're difficult to use. They're a little bit uncomfortable because they have to seal all the way around your face, nose, and cheeks. And in the hospital or in a care providing area, those who wear these have to be fit tested so that they do filter everything. So again, this is to protect the wearer. There's not a lot of them. And in general, they're used for healthcare workers or health providers with a few other limited exceptions. They are to prevent someone when they are around another who is infected. Now, off to the right, this is a surgeon's mask. It's paper, and it's specifically designed to be an exhalation filter. This protects the person next to you. Now, the way this was designed is to capture moisture. All infectious material, whether it's bacteria or viruses, are exhaled in moisture droplets, and this captures moisture. Very inexpensive. It's used in the hospital for years and years when a surgeon is working over an open wound and doesn't want his bacteria and viruses or whatever is in his nose and throat as normal bacteria to enter the open wound. So it protects the patient. These are used once, typically thrown away. They get damp, and when they get damp, they don't work, but they were only used by surgeons for years and years. And then it was recognized that using an exhalation filter is a great way to protect the people around you. And then we have all of these that have developed. They are the exact same principle. Typically, a tight woven cotton is best, but it's designed to capture moisture, and they work extremely well. So this protects the person that is next to the wearer. So if an individual is an asymptomatic or pre-symptomatic shedder of COVID, this protects everyone around whom they walk. So the health officer's order for all of us to wear these in public is really to prevent the spread of a virus from a person who is shedding virus as it captures moisture. The value of these is that they can be reused. And most people would do fine with only 2 of these because they last a long, long time. And if one gets moist, then you just replace it with another one. Now in the bottom right, I have 2 that are circled. And these are, I could have put the line across it, meaning prohibited, but I wanted you to be able to see these very clearly. The person on the left who has the mask below her nose, this is not effective. I believe that I would be on good grounds walking up to her and saying, excuse me, that needs to be over your nose. You're wearing that to protect me. And by you putting that below your nose, I am at risk if you are shedding virus. And then the one on the right is one that confuses people the most. This is sold as either an N95 on the internet or other fabrics, but you see those black exhalation valves? Those exhalation valves mean that this mask does not filter what is being exhaled. This, it protects the wearer. The most common use for these is in industry. People who are cutting a lot of wood, such as those that work in Home Depot or Lowe's, or people that are working with dust, or people that are baling hay or out in the fields. This protects them from inhaling those fibers or inhaling those dusts, but there's no restriction to exhaling. This is not what you want to see someone wearing, because if that person is shedding virus, you are not protected. So the mask story we understand right now is fantastic. Each cotton mask can capture millions of exhaled virus particles. And since it's an exhalation filter, almost anything that is tightly woven cotton will work. If it's loosely woven cotton, then it should be several layers. Now, this is new. This is extremely interesting to all of us, that we now can quantitate infection. So in general, an infection results from exposure to a virus for a period of time. Both of those can be quantitated. That is, how much exposure and how much time. And just as global examples, outside, the exposure is minimal. In the wind, the exposure is minimal. Inside, where there's no air currents, the exposure is higher. And the closer one gets to someone who is expelling virus, the amount of exposure is higher. So this is what we don't want to see currently. That's two people talking this closely. We know now that approximately 1,000 viral particles can cause an infection. So if we look at the picture on the left, the gentleman with the white hair, if he is infected, he is expelling about 200 virus particles per minute just by normal conversation. And since it only takes about 1,000 virus particles to cause an infection, a 5-minute conversation this close could cause the gentleman on the right to get an infection. So regular talking expels about 200 virus particles per minute, and it only takes 1,000 to get infected. Interestingly, a cough or a sneeze expels about 200 million. So if someone in a close conversation would happen to clear their throat or have a forced cough or sneeze, the person this close to them cannot avoid an infection. Interestingly, the masks that we were just looking at prevent this completely. So if the gentleman on the left with the white hair was just wearing a cotton mask, this conversation could go on very safely, but we still don't want it to happen. We still want to social distance. So that's what we're learning. We're able now to quantitate the time and the type of exposure that occurs. By the way, I told you talking is about 200 particles per minute. Loud talking, it goes up to about 500 or 600, and you can imagine as it goes on further up. So this is indoor, and this talk about social distancing, and these numbers come from without a mask. So what we're talking about is social distancing and a mask to give us double protection. So we all know now that the recommendation is to stay 6 feet away. That is because if the boy in the cartoon on the left is expelling 200 virus particles for every breath or every time he's talking, by the time the person on the right, the girl on the right, is 6 feet away, those will fall to the ground and not be infectious. So if the gentleman, the boy on the left is infected, but someone is 6 feet away from him, that virus will not travel that far. And this is indoors. That virus will not travel that far. It will fall to the ground. And then below that, you can see some of the things that are being suggested for restaurants or for break areas. And what we're attempting to show here is that the tables are far apart, but if two people are sitting at a table, they should be far apart as well. Now, I show this because our county or the Bay Area counties, these people would be wearing a mask, but that's not uniform. All counties in California are not mandatorily wearing a mask as well as social distancing. And I want everybody to understand that. So if someone is not wearing a mask, either because you're in another county or another state, stay at least 6 feet away. And then numerically off to the right, I don't want to go through the math, but this is what happens with social distancing. Where we see day one, if that individual is infected, and there is no social distancing, by the time a month passes, he or she will have infected over 400 other individuals. On the other hand, if there is social distancing, even if that person is coughing, it's going to be extremely uncommon for anybody to get infected. And the mathematical modeling is that only 2 to 3 people will be infected. So social distancing is dramatically effective, just as masks are dramatically effective. And again, this is indoors. So you must stay away from other people indoors. And if you see someone who is not wearing a mask or not wearing a mask properly, you can tell them that they are putting you at risk. Now, I said emphasize that this is indoors. Outdoors is completely different. Outdoors, the exposure to the virus is dramatically reduced. The air currents outside dilute this virus tremendously and very quickly. So what is recommended for outside is you don't need to wear a mask outside unless you're going to be coming very close to someone. And what is said many times is if you're going to take a walk, walk your dog, ride your bike, walk with household members, you do not need to wear a mask outside, but carry one with you. And if someone is coming in the other direction and they're opposing you, you want to put a mask on as a splash guard, as well as to protect them in case you cough. And then as they pass you from behind or pass you coming in the opposite direction, you can take your mask off again. And these are just some do's and don'ts that are pretty common to all of us. And where we have on the don't side is very clear. And this Supervisor Anderson emphasizes this all the time. What we can do, what we will be permitted to do, will be guided by Dr. Farnatano and our county health department, as well as our state health department. Now, the last thing that I'll talk about is the fear or the misunderstanding of this virus on surfaces. And this is a table that I made from several papers, and I want to go through it. Doorknobs and high touch areas are important because when we touch a doorknob or when we touch a fixture in a bathroom, and if we have virus on our hands because we just wiped our nose and we are shedding this virus, that virus can be detected for a long period of time because of the oils on our fingers. That's what keeps the virus viable. This virus is extremely susceptible to drying. That's why air currents kill it right away. Now, wood, plastic, cardboard, clothes, even the surfaces of the skin, you can see how long the virus lasts. What I think is the potential infection are high touch areas. High touch areas are things like doorknobs, perhaps cabinets in the kitchen that have a metal handle, fixtures in the bathroom or in the kitchen. Those are high touch areas. They need to be disinfected if you're in a household with someone who is shedding the virus. But that's about it. It's really not a risk of cardboard, of clothes, of things that are in your supermarket. The concept of clothes and cardboard causing an infection has just never materialized. It's not necessary to wipe down cardboard. It's not necessary to throw away clothes from a person who may have got contaminated from another person. People in the hospital just wash their clothes in a regular laundry. Special care is not necessary. And to this day, I don't know of anyone who has reported an infection coming from a cardboard box or from clothes. So that's very risk or very low risk. But what's most important is this. Let's assume that we don't have all the answers. Let's assume that well, maybe that cardboard that has that virus on there for a day, maybe it is infectious. And I don't want to take any chances. This is the bottom line. It's got to get from that surface into your mouth, nose, or eyes. It doesn't jump through the skin on your hands. In fact, I've said this many times, you can dip both hands into a solution of coronavirus and you will not get infected unless you touch your face. That virus it has to get into the face. And so if you're opening a delivery box, or you think you've touched clothes or skin, or maybe even something in a grocery store, a shopping cart, whatever it may be, that virus could be on your hands. But if you use hand sanitizer or wash your hands before you put your hands to your face, you will not get infected. And everyone recalls that when we first started this, before we implemented social distancing and before we implemented masks for everyone, the first thing we said was don't shake hands and don't touch your face. And if you don't touch your face, your only risk of infection is face-to-face contact with a person who is shedding virus. Now, as an interesting side effect, wearing a mask when you're outside does keep us from touching our face. So it's not what the mask was designed for, but it does work that way. And so, Mr. Mayor, I'm going to stop with that. Thank you all very much for everything you have let me do here. And it's always a pleasure to join you.
You always had just a wealth of information, and it is so reassuring when people get good information. It allows them to make decisions in that context. So thank you, sir. This is the chance where we turn to Stephen Spadowski, the question meister. And if we have any questions from our listeners or that have been sent to us.
Yeah, we have a lot of questions. And again, every week it seems like we're not able to get to all of them. So we do keep a running list, and we'll try to ask in future broadcasts or get back to you directly. But the first one that I would like to ask Supervisor Anderson to clarify the statement about the fatality. We are getting questions about the age and location, if there's anything else that you can share.
Yes, and I was going to just clarify, I don't know where the 3 people whose deaths were reported yesterday lived within. I know they live within Contra Costa County, but I don't have any specifics about which city they're from. One of the individuals I do know was in the age range of 30 to 40 years old. So that's all I know. I don't know the gender or what city, but if I gave the impression all 3 deaths were in San Ramon, not the case. You did see, a rise in cases, but as far as I'm aware, no deaths here in San Ramon in this recent period.
All right, I have a question for Mr. Scott. How do you see faith-based organizations changing the way they provide services in the future?
Well, I think the biggest change is the proliferation of online services. I really do think that those are going to go up and they're going to stay up. We've just seen like 5x the increase in online participation. I think worshiping online will be a regular option of the way. I don't think it'll ever replace the actual gathering of the physical church, although I do think we're still quite a ways away from that. As I can speak from our church, Stephen, we're going to follow the guidelines of the county and to follow the guidelines of the government. We're not going to get ahead of that. We're not going to open our doors. Ours is one of, if not the largest church in our area. And so we're definitely going to be in the latter phases of opening because of the sheer number of people. So in terms of expectations, I think we're going to end up being the last group to open. And I'm okay with that because we want to be for the people. We're in an area where if you look at pastors or people that in faith-based organizations as shepherds, which you see in the scriptures, a common reference for that, we're not really protecting sheep from wolves at this point. We're trying to protect sheep from other sheep. And when you don't know who's infected or not, we're going to be taking great care with social distancing and but one of the things that you're thinking about what makes church gatherings unique is the ability to come in or shake hands or hug or even worship where you're able to sing out. And a lot of those things are not really conducive to wearing a mask or when you can only have 8 people in a row that seats 20 and you need 2 rows on each side. And so those types of things make me believe that the gathering of the church is still happening, Stephen, because the church isn't a building. The church is the people, and people are gathering right now. It's in their homes. When this next layer of restrictions is lifted, perhaps the number of the people can gather with will go to 10 or 20 or something like that. Maybe the next jump will be around 50. The opportunity, I believe, for people to gather in places of worship will be in their homes, which is how the church started if you go back to the beginning of the early church.
Great, thank you. Mr. Conklin, there's a question for you. What are some of the biggest challenges to those who are currently serving? Have you heard any situations with families with service members, and how can we assist them?
You're on mute, Mike.
Sorry. A couple of things. This time of year is when most military families are moving to different bases across the nation, around the world, moving from one base to another with family, or if they're single. That's all been put on hold for the foreseeable future. So a lot of families are kind of in limbo. They're still housed and taken care of, but that's creating a little bit of anxiety. My son is scheduled to go to Korea for 2 years, leaving in June, and that's been put on hold as he ends his job at his other base. So there's some anxiety there. The other bit of anxiety for the current active military is those that are retiring, either ending their enlistment or retiring at 10 or 20 years. The anxiety is they all know that when they get back to their communities, they've got to find a job, most of them. And of course, nobody is really out there beating the bushes to hire people right now. So they're a little worried about their futures and their families' futures with that respect. They're going to come home. The younger veterans are going to come home and have a couple of options. One is to get into school through the GI Bill. That is also up in the air because a lot of the universities just don't know what they're doing. And even though they may be accepting applications, they can't tell you whether you're actually going to be going to a physical site or it's going to be offline. So there's some anxiety there. And again, a lot of the younger veterans are going to be out seeking work. And with the unemployment rate the way it is, the unemployment rate with these departing veterans from service is going to spike a little bit. So those are kind of the anxieties there. The military bases really do an excellent job of taking care of their families. And so we've got 2 sons on different military bases right now. And boy, the families take care of each other. The medical people take care of everybody. It's just wonderful. But again, it's a very compressed demographic of people that all work on the same base, that all know each other, et cetera. So they have some advantages there. As far as the big thing with these veterans is isolation and loneliness. And you can imagine that someone coming home, it would be very easy for them potentially to become isolated and lonely, leading to all the other things, substance abuse and depression, things like that. So I expect that we'll see a spike in the services needed for those individuals. Again, I can't tell people enough about this county. Go, if you have a young veteran coming home, first thing you should do is go to the county veteran service office, sign in, get registered with the VA. They get a free medical at that point. They have 26 weeks available of unemployment insurance that they are due, they earned. Sign up for that. Get down to your community college online, sign up for that. Call us, call the other veterans groups if you're needing employment or some help, and we'll figure it out. So we've got great resources here in this county. If you can imagine going to a county like Kern County or Modoc or something like that where there's nothing, the veterans coming back to this county have got it pretty well covered. All they have to do is walk forward and ask for help.
Thanks, Mike.
Thank you. And Dr. Joseph, we have a lot of the questions were answered by your PowerPoint slides. So hopefully with your permission, we can post that on the city website, a copy. And also I wanted to let people know that we're starting to extract clips from the mayor's breakfast and posting them separately. So we'd be happy to do that with Dr. Joseph's presentation so you can get his narrative along with the clips. A question for you, Dr. Joseph. Do we know if having the virus will impact or is likely to impact an individual's health later in life, similar to polio?
If an individual is hospitalized with a severe respiratory infection, it is likely that they will have permanent lung damage.
Right.
Anytime there is a severe pneumonia, it does cause scarring, but the amount of scarring is individual and depends upon an individual's biology. So every time we treat someone in the intensive care unit with a severe respiratory disease, part of their follow-up is after 6 months to have pulmonary function testing to identify if there was any residual. For those who have a milder disease, who are not hospitalized, it's mostly a bronchitis, and the likelihood of any long-standing pulmonary problems is very low. Most that I know of have had complete recovery if they've not been in the hospital. There are rare exceptions with this virus that can affect other major organs. So this virus can affect the heart, it can cause a stroke, it can cause blood clots. There is a new pediatric syndrome that's very similar to Kawasaki's disease. All of these are in the 1 to 2% of the 100,000 or so, and 1.5 million in the United States. So it's a substantial number, but a small percentage. All of those will have some long-standing complications.
Great. Next question. Recently, the CDC announced that it's not easily spread from surfaces like playgrounds and other surfaces. You went over the how long it lives on each surface, but is there any new information, and do you agree with that statement from the CDC that it's not easily spread?
Absolutely. That was the purpose of my last 2 slides. There are 2 components that the CDC addressed in their comments this week. One is that they demonstrated the virus on the surface, but they did not demonstrate that the virus was infectious. So they're 2 completely different things. I tried to show those numbers, but emphasize this is a person-to-person infection. Almost everyone who gets infected gets it from an infected person. On the rare occasion of high-touch surfaces that may transmit an infection if you put your hands to your face. The earlier concept of disinfecting cardboard, disinfecting clothes, disinfecting areas around the house is no longer recommended. We all see what's being done on airlines and in subways. And I think that's because it's completely unknown if those surfaces were highly infected with moisture, and they're just doing that out of an abundance of caution. But we do not need to do those things routinely. So yes, I agree, and that was the purpose of the slides.
Great, thank you. For Supervisor Anderson, why doesn't the county allow cities to submit compliance plans instead of trying to use a one-size-fits-all for our county? Contra Costa is extremely different as you compare the different cities.
Well, I think that one of the primary reasons is that each city doesn't have their own health officer to come up with those guidelines. And it's sort of the same reason that as a Bay Area region, we are working together with all of the counties coming up with similar guidelines, because we're really one ecosystem, so to speak. And we share a lot of transportation, transit, our jobs. Many people living in the San Ramon Valley commute down to Santa Clara County or into San Francisco or into Alameda County. And so you have just a lot of mixing of interaction with one another. And so the enforcement is up to each city. They get to decide how they're going to enforce the health officer orders. And so you've really found each city, for the most part, their police departments have chosen not to be out issuing citations unless it's just a gross violation, like a bar opening up and encouraging patrons to come in. But for the most part, it's been educational. And so this time, because our cities really don't have the capacity with a health officer creating those orders, we don't encourage it. Certainly a city could choose not to enforce a health officer's order, and it's not like we're going to send the sheriff's department in or call up the state to send in the National Guard. But what we're doing really is trying to have our city managers coordinate with our county health officer, ask the hard questions. As Mayor Clarkson has said, he has had no hesitation in really trying to delve down deep of why do we have these orders? Why haven't we, we look at the numbers, we look at the statistics. So we really are a shared community. And from my perspective, it doesn't make sense to having local officials making those decisions. I want them to be medically sound, scientifically sound. And so when people question me even of, why are you letting a health officer make these decisions? I'd really would much prefer having a medical professional making these decisions and not a politician who's getting political pressure to do something. And so that's the reason we have the system we do.
Steve, we're probably at the end of our time. Is there a quick question you might ask? Is there one burning that you want to get out there?
Well, there are several related to Dr. Joseph's PowerPoint slides. A couple questions. One, and I can kind of try and combine them together. But how is not being exposed to illnesses in general going to affect our immunity systems for the upcoming flu season?
It should be completely unrelated. So this virus is completely different from all of the influenza viruses that circulate seasonally. We don't know if this is a seasonal virus or not. Predictions are all over the board, and I never make a prediction. I'm usually pretty good at telling you what has happened, but not what's going to happen. But there should be no relationship whatsoever to this pandemic regarding our immunity to flu season this coming fall.
Great. And the final question, and Dr. Joseph, only if you have it handy and if you're comfortable, people are wondering what you use personally when you go outside, what your mask looks like and what you use to cover your face.
I have a soft cotton mask that I wear because it's comfortable. It's an exhalation filter, so I'm wearing it in case I'm an asymptomatic shedder to wear to protect those around me. I've picked out of all of the ones that people have given me and made for me, the one that I use, it was made by a quilter, because quilter's cotton is the most dense cotton on the market and extremely comfortable. And I don't even have to think about moving it.
Oh, thank you so much.
Hey, Doc, I have one question. What is the typical start month of flu season? I personally think it's like October. Am I wrong?
Well, now we're talking about influenza and not coronavirus.
Correct.
Influenza starts in the Northeast and moves west. So in October, maybe even in September, there will be cases of influenza and maybe clusters of influenza in the East. Our biggest season in California is usually late December, January, February.
Okay.
Because the flu shot does not provide long-lasting immunity, we stagger the timing for flu shots. So widespread travelers have to get it early, of course, because they may be exposed any place. But if you stay in California, generally flu shots late October, early November are the best.
Thank you.
Good information. I want to thank everybody. Pastor Scott, thank you, and for showing off your mask. Mike, appreciate all your service to our veterans, of course. Candace, keep up the good work and keep us informed. To hopefully see you next week. Dr. Joseph, as always, you're so informative, and thank you for allowing us to share your slideshow on our website. Steve, coordinating everything is really, really important, and we appreciate how you juggle all those balls at once. And of course, Joe, thank you for what you're doing for our city. Next week's broadcast is going to be all about children, and we hope to have child care providers. The city is going to talk about our upcoming summer programs. And Candace, hopefully you can be available. And of course, Dr. Joseph, if you're available next week. A lot of people are concerned about keeping our children safe. So next week will be all about children and planning for this summer, including a mental health professional who'll be talking about the mental health that a lot of our kids are experiencing and how we can keep them hopefully well balanced. So thank you all. Have a safe weekend and have a nice day. Take care. Bye-bye.